Our parents never quite get what we do. I got to be a speaker at this event one day at LA Leaders Forum, and I invited my mother for the first time while I was at PSR, and she's, I know what you do. That mouth of yours that I thought would end you in jail is now working for you. And so I don't use the term that my mother thought I would end up in jail, and I'm incredibly inspired by all this, but I stand here before you because of organizers. I would not be alive if it were not for youth organizers who came into my school, organized our school, and my connection with them has been, I'm 55, this was when I was 15. It is what saved my life, it was what got me to college, it's what got me to be part of some incredible social movements, and that is that I met a core of young organizers who thought it was important to come into our school after this police shooting, and it was important for them to teach us organizing. It was important for them to teach us that we live in a multicultural world, and this was in the 70s, and it was Black Panthers who came into my school in brown berets. And those lessons about organizing and the difference between organizing and mobilizing, and that we do have agency and power as a 14 or I can't remember how old I was, but and who is organizing matters. Because as a young woman who was in a gang in the 1970s, most of the gang workers were male gang workers. And my gang decided I would speak for them. And that was not allowed. And so my leadership development has always been in opposition, has always been, I'm going to have to fight for my place at the table. And it has armed me well. But it has also taught me that we need to start making people being at a table much easier than it currently is. I just needed to say that because I'm sort of very moved by all this. But I came to Physicians for Social Responsibility from working in the health field. And I came specifically to change the narrative about pesticides. In California, there had been a strong pesticide movement, and we couldn't win against the power of the ag industry. And the more we looked at what the data was saying, and National Academy of Sciences study on the effects of pesticides on the lives of children was one of the seminal science tools that we used to build our fact sheets, to build our talking points, to start making policymakers understand that pesticide use is a health issue. And we were really effective over the course of about 5 years. And how we measured that effectiveness is that when we first started introducing policy, they were going through assembly toxics. Within 3 years, we were doing a bill around pesticides in schools, and that bill went through the health committee. And so we knew we'd made a shift there. But as a coalition of 175 groups, we needed to make another shift. And this, again, speaks to this idea of power and who you're organizing. And at that point, we were really mobilizing groups in San Francisco. We were trying to get groups throughout the state of California. But even our steering committee did not reflect the most impacted people by pesticides. And so we did a lot of internal organizing to shift the character of our steering committee and who our members were. And within 5 years, we'd completely transformed that steering committee. It was primarily women of color, folks who were impacted, folks in the Central Valley. And so we started to be able to change. Within our organization, the coalition, change the conversation about the kind of policy work that we needed to do. Because when you expand your coalition and you're bringing groups who are doing grassroots organizing in the Central Valley, in Los Angeles, it started to change our agenda. And something Tony often talks about is the ability to be nimble, and which is critically important. So we're a small organization. The biggest we've ever been is 6 staff, and we take on some big people. We took on pesticide industry and the ag industry. Just this last year, we took on the issue of fracking and unconventional oil drilling and flame retardants for the last 7 years. And we're just on the ends of a big, giant victory in the state of California after over a 10-year battle with toxics advocates, changing the flammability standard around couches. And how we know we made, California was driving the use of those flame retardants. But to get to that place where we can get the governor of the state of California to say, thou shalt change that rule, we went through a lot. We went through a lot in terms of policy, but where we were failing is who was showing up in Sacramento to talk about the issue. And who was showing up was your traditional environmentalist. And no disrespect for them, they're wonderful. But it didn't look like California. And the strategy was, there's this big Bay Area, if you're from California, there's this northern-southern California split. And you had this strong environmental movement, mostly based in San Francisco. But you had no toxics movement per se in Southern California. And so what I had discovered as working at PSR is that we needed to build this movement, change the narrative about the environment to be really about what people cared about. They care about health and wellness. Health is power. I've learned that working in the Ministry of Health in Nicaragua, which is an amazing experience for me right out of school. And I really, that experience taught me that being creative, building relationships, and that leadership is part of being a connector. And so we were, as a small organization, we were very effective at taking, if you collectively take the years of experience of our staff, we had over 100 years of experience in a broad range of fields, and hundreds of years of experience of relationships. And we were able to build on those relationships to create, to start to shift the narrative around this issue of pesticides. And then we started. And out of that, actually, people started coming to us. How did you do this? How did you get the doctors there? Which is no easy task, to get a doctor to a hearing, to get a doctor to sign a letter. And that's when it hit me that my purpose in life was to unite the powerful voice of communities with the credible voice of healthcare professionals. And that can really create a movement for change. Because now you're taking the power and the knowledge that lives in communities and uniting it with someone who is incredibly trusted and credible. And we were very careful about uniting that in an equitable way, so that we're not the ones who know everything and are driving the policy. We try as much as possible to work from the bottom up, and that's when policy works. And we've done lots of different policy campaigns, and the best ones, the ones that work, the ones you can enforce, the ones you can track, are the ones that really bubbled up from the ground. And so when we were working on the pesticide issue, I was going to everybody I knew in LA. Can you sign on to this bill? We're doing this bill. And I was trading on a relationship of trust, because it was a new issue for many folks, something that folks had not worked on. And so hundreds of people we called, and I started to see that there was this, and I was also educating myself. I was immersed in the science. I don't drive in LA, and so I had an hour-and-a-half bus ride from where I lived to my office, and thank God for that hour-and-a-half drive, because I would not have been able to sort of read up on the science of environmental health, which I had no background in, had it not been for that commute. And so we were able to, I started to see some strong connections, and I had the freedom at my organization to say, a lot of these chemicals impact women's health in a very particular way. Why aren't we working with reproductive health and justice groups? Why aren't we talking to other folks? Why aren't we talking to tenant rights groups who right now are organizing to have a building fumigated? That's not a tenants' rights victory. Tenants' rights victory is actually fixing the problem, making it more habitable. And so we really did a lot of this cross-movement organizing, and a lot of it is culminated in these, I'm talking fast because I'm running out of time, but this kind of ability to bridge these different movements was really critical for us in winning both on the flame retardants issue, but also on the issue of bisphenol A. So in California, in other states, most of these decisions have been bipartisan. Not in California. Not a single Republican vote really on AB 32, which was our climate change laws. On the bisphenol A, we got no Republican votes. We kept getting killed in committee even by Democrats when we were working on the flame retardants issue. But when we took it outside of Sacramento and started going to communities and talking to women about the real health problems that they're experiencing and that their friends are experiencing, whether that's not being able to get pregnant, longer times to get pregnant, whether it's whether it's low birth weight. When we started to talk about these and look at what the properties of the chemicals that we were talking about, folks made the link. And so we were able to get this amazing group of reproductive justice groups and environmental justice groups and environmental health groups to work together in California, which is not easy. And that is the group that made the difference. It shifted the terms of the debate to the one that women of color actually care about these issues in Sacramento, because that was the narrative. We were able to move that force of women to take on this issue despite incredible attacks on reproductive justice and reproductive rights. They came with us as a movement. And this has actually been written about in a couple of publications, how we did that cross-movement organizing and why it was effective. And I'll leave you with my favorite story of why that worked, is we expanded the network of people that we worked with around the toxics issue. We're now being able to take those same networks and relationships and start pivoting to be able to work on the issue of air quality. And so now we have this cadre of healthcare professionals, women's health advocates, and a growing body of evidence around the links between air quality and birth outcomes and reproductive health. And so we're able to take the science that's being produced, and that's what we're good at, is sort of like, we're reading all the journals all the time, and then saying, this is emerging, this I think we have enough evidence to be able to develop a policy around. Then we are working with our folks on the ground who are telling us, this is a problem, can you help us, can you support us? And that's been really important. And I think the thing that is important to remember is that as an organization like ours, we have to be nimble, we have to be brave, not worry about pushing at the limits of our mission. Because if we had been worried about mission creep and moving beyond our mission, we currently wouldn't be working with the residents in South LA. And that has been an amazing experience to be able to be with folks who aren't working on the environment, but are working on social justice, are working on equity issues. And when those residents found out that there's a contaminated site with lead, a bunch of other bad stuff, they knew who to call. They called me. And we were able to very quickly mobilize ourselves, meet with the Department of Toxic Substances, get an extension to the deadline, and bring other experts from UCLA, experts on lead, on soil remediation, to a community who did not have this expertise. But what do they do well? They're really good organizers. And so that having that kind of support and that kind of role as a connector has been an amazing experience, but has really taught us that it's important to invest. And just like people don't sort of grasp how hard it is to be a community organizer and the risks you take and the things that you see every day that require healing every day. I think those organizations like ours that are connectors, who make it seem that it's easy to sort of pick up the phone and call 10 people, that also has to be valued in terms of how you make that change happen. And then the other part is making your research more accessible to us. So it's a lot easier to take that research that's coming out and saying, this is what it means in terms of community health. This is how we're able to organize around this particular issue. So we're always looking to the horizon. What is the next emerging issue that we need to know about? Because our partners, 50, 60 organizations that we work with just in Southern California, are bound to call us and say, do you know about this? Do you know about lead? Do you know anything about arsenic in the groundwater? And so we have to, that's how we have been able to build this expertise, is by being of service. And I think that that's a really important part of figuring out what the relationship is between what we need in terms of a research base and how that moves into policy. Thanks.
Thank you. Now, our final panelist, Gregory Angelo.